Time now for our weekly check-in on infectious diseases with Dr. Isaac Bogoch, infectious diseases specialist at University Health Network. Dr. Bogoch, always good to talk to you about this. We've talked a lot about this in the last 5 years, but let's talk about this again because the province's fall COVID immunization program was released a few days ago. It's part of the overall respiratory virus campaign and, of course, comes as COVID cases are on the rise and a new variant has surfaced. So I've loaded up the question here, but really it's this. Has much changed in terms of guidance or who should get it or when?
No, not much has changed. It's still important to recognize that COVID is still out there. It circulates year round, but there's times of year where there's more of it around. And that time of year is unfortunately now. We're starting to see more and more cases. The cases are going to continue to build throughout the fall and the winter before they start to drop off, probably in the early to midwinter. There are, as many people know, vaccines available for this. The vaccines are going to roll out shortly, probably early next month. And remember, the vaccines have changed significantly since their initial rollout in very late 2020 and early 2021. They do a remarkable job in reducing the risk of severity of illness, especially in those at greatest risk for severe illness. They used to do a great job in blocking infection and onward transmission. Now they do that to a much lesser extent. They still do it, but to a much lesser extent than before. So the guidance is really for people who are at greatest risk for severe infection. There's wording that says these people should go out and get the vaccine. People over the age of 65, people in long-term care facilities, people with underlying health conditions that put them at greater risk. It's a very good idea for those people to go and get the vaccine in general. Of course, if anyone has any questions, talk to a doctor about it. Yep. And then everyone else who isn't in that should get the vaccine category may get the vaccine, and the vaccine will be available for those people should they choose to get it.
Okay, interesting stuff there, Dr. Bogoch. And on the vaccine, it's interesting because, development across the country, it's free here in Ontario, but next door in Quebec and then west of us in Alberta, they're going to start charging for the vaccine. Shots are going to cost about $100 to $200. What are your thoughts on charging for the vaccine now?
So I think it's important to clarify that for people in the should get the vaccine category, it's free. So people with risk factors, people over the age of 65, it's still free for them. Those who are in the may get vaccinated category, there will be a charge for them. I'm of the mindset that we shouldn't put barriers up to clinical medicine and public health. And I think charging is a barrier that may dissuade some people from getting a vaccine. And, I think we should lower barriers, not raise them, and take steps to ensure that everyone has free access to healthcare and public health initiatives.
Okay, that's good to get your perspective on. Here's a scary thing, Dr. Bogoch. I scrolled through the comment section on Twitter yesterday as I was preparing.
Always a good idea.
It was interesting, but one thing that did come up, and I thought was a really interesting question, was what to do with old or expired COVID tests. Do they have any value at all? Can they be used to test for new variants, or would we need to find new tests, which seems harder to do if we thought we had COVID-19? What's the advice here?
Okay, so there's technical advice and then there's real advice. The technical advice is anything that's expired, chuck it. It's as simple as that. If it's an expired drug, if it's an expired test, get rid of it. And I think most people would look you in the eye and tell you with a straight face that is the reasonable thing to do. What's interesting, though, is sometimes there's expired products and, does it still work? The answer is probably yes, but you don't know for sure. So the safe bet is to throw it out. Having said that, sometimes companies will look at expired items, do sophisticated tests to see is the sensitivity or specificity of that test still does it still adhere to the highest standards? And sometimes it does. So sometimes expiration dates actually can be pushed back further. You can't do that at home. The safe bet is just to discard any out-of-date tests or out-of-date medications.
Okay, really appreciate your answer on that, Dr. Bogoch. It's always good to talk to you on these Tuesday mornings. Have a good week, and I'm sure we'll talk soon.
Thank you so much, Nick. Have a great day.
Thank you.